Hello friends, how are you? I hope you are fine. So today I'm going to read the Indian Express article on explain page. So here we go. An expert explains COVID-19 and your children. More children have been infected in the second wave than in the first. Amid concerns about new variants, children's health and mental well-being as the schools stay shut, what should parents do or not do? If parents fall ill, what changes in the way they take care of small children? What do they do if child falls ill? We keep hearing of a third wave of COVID-19 and that children will be most vulnerable. Is that a real fear? Several experts have warned that the third wave is likely to affect the more children, as Singapore has already been reporting. One can get immunity either after infection or through vaccination. More adults have been getting infected in both the first and the second waves. Vaccination has been approved for use in adults. The absolute number of children affected in the second wave seems more than in the first wave, probably due to overall increased numbers and entire families getting affected. Are any of the new variants more dangerous for children than for adults? The new mutations, particularly the B.1.167 variant, have been reported to be affecting younger children in a few countries like Singapore. However, there is no official confirmation at this stage as to how many children have been affected by the new variant in Singapore. The B.1.7 strain is 60% more fatal than the original strain. It is believed that since the immunity of the children is better, they are not getting seriously sick even after this mutant virus attack. In general, are children at lower risk of contracting COVID 19 than adults? And among children, which age group is more vulnerable? Children are just as susceptible as adults. However, children with the COVID 19 are generally asymptomatic or have less severe manifestations. This may be attributed to a lower expression of specific receptors to which this virus binds to enter the host and also their immune system. A U-shaped curve of severity has been demonstrated in children with the infants under 1 year of age and adolescents between the age of 10 to 14 years of age with a higher risk of developing severe COVID. Infants might be seriously ill. Older children might develop MIS-C multi-system inflammatory syndrome after 2 to 6 weeks of asymptomatic or symptomatic COVID-19 infection. Are the symptoms in children different from those in adults? The most common symptoms are fever 63%, cough 34%, followed by nausea or vomiting 20% and diarrhea 20%. Similar to adults, the commonest clinical features are fever and cough. However, the frequency is much lower in children, that is 60 to 400% in adults versus 40 to 60% in children. Most of the children have mild to moderate disease and only 4% have a severe illness. On the other hand, features like shortness of breath, fall in oxygen levels, and sputum production are more frequently seen in adults. Like adults, gastrointestinal manifestations, diarrhea, vomiting are frequently seen in the children and sometimes may be the sole manifestation of COVID 19 in children. Overall, the respiratory symptoms followed by the gastrointestinal symptoms are the predominant manifestation in children as well as adults. Also, adults have a higher the chance of having a underlying comorbidity which predisposes them to severe COVID illness. According to US CDC estimates, COVID 19 hospitalization rates were 80 times higher among adults older than 85 years than among children between the ages 5 to 17. Death rates for adults older than 85 years were 7,900 times higher than for children. What should people do if they suspect their child is showing symptoms of COVID 19? Children with documented or suspected COVID 19 and mild symptoms, fever, cough, Laryngitis generally should be managed at home unless they have an underlying health problem like asthma, heart disease, diabetes, muscle dystrophies, and refractory epilepsies. This may increase their risk of severe disease. Management at home is a focus on prevention of transmission to others, that is, isolation, monitoring for clinical deterioration, and supportive care. Treatment for mild cases is symptomatic. Children at home should be monitored for the development of severe COVID illness. Manifestations include difficulty in the breathing, grunting, inability to breastfeed, chest pain or pressure, adolescents, bluish discolorations of lips or face, cold, clammy, mottled skin, substantially reduced urine output, new onset confusion, difficulty in arousing. Besides, there should be a regular communication with the doctor. Duration of isolation for symptomatic patients 10 days after symptom onset plus at least 3 additional days without symptoms. For asymptomatic cases 10 days after positive test. If a child is COVID positive, does she need to be isolated if her parents are vaccinated and if they are not? If a child tests positive and their parents are negative, parents can continue to take care of the child. However, while caring for their child, parents should use a proper mask, wear PPE, including gloves, avoid leaving the child with her grandparents. Families shouldn't rush back into pre pandemic life, even if both parents are fully immunized. Can a pregnant woman pass on SARS-CoV-2 to her new unborn child? At this time, there is not enough evidence to determine whether the virus is transmitted from a mother to her baby during pregnancy or the potential impact this may have on the baby. This is currently being investigated. Pregnant women should continue to follow appropriate precautions and seek medical care early if experiencing symptoms such as fever, cough, or difficulty breathing. What should parents with a very small child who cannot be kept away from them do if they catch the virus? If you have a COVID 19, you will not be able to hug your child or touch them in any way without putting them at risk. Younger children may find this very difficult to adjust. Even if you are sharing the same space, you can consider coming up with creative ways to communicate just to liven up the atmosphere. Perhaps you can speak over the phone with your child using one that you don't use. Make video calls or send each other emails if you have devices that are not shared. Get a family member or friend to speak to them regularly over the phone. According to the CDC, everyone at home who is above the age of 2 is able to remove the mask by themselves and who does not have breathing issues should be masked at all times if there is a COVID 19 patient at home. Surfaces should be disinfected frequently. A distance of at least 6 feet should be maintained between you and your child. Is it safe for a COVID positive mother to breastfeed? At present, data is not sufficient to conclude transmission of COVID 19 through breastfeeding. In infants, the risk of infection is low and the infection is typically mild or asymptomatic, while the consequences of not breastfeeding and separation between the mother and the child can be significant. So, at this point, it appears that COVID 19 in infants and children represents a much lower threat to survival and health than other infections that breastfeeding is protective against. Based on the available evidence, WHO recommendations on the initiation and continued breastfeeding of infants and young children also apply to mothers with suspected or confirmed COVID 19. With the schools shut down, what should parents do? or not do to ensure the mental well-being of children? During the pandemic, psychological problems like anxiety, depression, irritability, mood swings, inattention, and sleep disturbance are fairly common. 79.4% as per a recent meta-analysis of 15 studies from the 10 countries describing 22,996 children or adolescents among quarantine children in several studies. Children with the pre-existing behavioral problems like autism and attention deficit hyperactivity disorder have a high probability of worsening their behavioral symptoms. Parents and young children. Parents should devote time to provide younger children with undivided positive attention and reassurance. Children need to be given fact based information about COVID 19 with the help of presentations and video material provided by the authorized organization like WHO, UNICEF, or government resources tailor made for children. Children's exposure to news should be limited and should be to fact based content. Effort should be made so that a consistent routine is followed by the child with enough opportunities to play, read, rest, and engage in physical activity. Parents and adolescents. This is the best time for parents to model the most important life skills, that is, coping with the stress, coping with the emotions, and problem solving with their children. Adolescents are expected to have a better knowledge about COVID 19 compared to young children. Therefore, communication has to be more open and non directive. This is an opportunity for older children to learn responsibility, involvement, and collaborations. They can learn skills including the cooking, managing money matters, first aid, organizing their room, and contributing to managing chores. Excessive internet use relating to COVID 19 should be avoided as it results in anxiety. Similarly, excessive and irresponsible use of social media or internet gaming should be cautioned against. Taking up creative pursuits like art, music, dance, and others can help manage mental health. Adolescence is a phase of enthusiasms and risk taking. Hence, some may try not to follow guidelines. This has to be addressed assertively. It is advised to parents to take care of their own mental health needs. Can COVID 19 cause developmental delays in children? In a meta analysis that included 9,335 children within the age of 0 to 19 years from 31 countries with the documented SARS-CoV-2, neurological symptoms were present in 12% of children. This is common in those who develop MIS-C. Only 2% of the children develop life-threatening neurologic involvement like severe encephalopathy, stroke, central nervous system infection, etc. The struggles faced by children with special needs are diverse, including higher risk of SARS-CoV-2 infection, restricted access to healthcare facilities, limited capability to practice preventive measures, along with increased rehabilitation needs due to interruption of schooling. The concern of the children and their caregivers should be resolved with appropriate solutions to accomplish an inclusive healthcare response to the global pandemic. Children with chronic neurodevelopmental disorders are a vulnerable population in this regard. Should parents delay other vaccines for child with a suffering from or has just recovered from COVID-19? Routine immunization can be continued 2 weeks after the child is asymptomatic of COVID infection. If a child needs some higher medication such as high dose steroids which suppress the components of patient immunity, immunization needs to be deferred for 3 months after the medication has been stopped. What should parents do to protect babies and small children who cannot wear masks? The Indian Academy of Pediatrics recommends that masks needs to be worn by all children above the age of 2 years. If decision is made to use a face shield, it should cover the entire face, wrap around the sides of face and extend to below the chin. Caution should be taken while wearing One, to avoid injuries that could break it and harm the eyes or face. You should never use a mask on a child under the age of 2. Avoid unnecessary public contact. Keep yourself, your baby, and any siblings at least 6 feet away from other people. If you can't leave an infant or young child supervised at home and you must go out, keep the outings short. If you must take your baby out in public, cover the infant carrier, not the infant, with a blanket. Do not leave your child alone ever. Keep your hands clean. Remember to always wash your hands and any siblings' hands as soon as you get home. Use a disinfectant wipe or spray several times every day to clean surfaces at home that are touched often. Teach older children to avoid touching their faces. The expert, Dr. Shefali Gulati, who has 2 decades of experience as the faculty of the AIMS Department of Pediatrics, specializes in child neurology and neurodevelopmental disorders. She has over 200 publications in international journals, has served as a member of the ICMR task force, and serves as an expert for development of the National Epilepsy Control Program. Thank you very much.